Welcome back to Your Health Matters. I'm Peggy Pico. Depression and bipolar disorder affects millions of Americans every day. It's a debilitating illness that, if not properly diagnosed and successfully treated, can lead to devastating consequences.
During my depression, I was suicidal, extremely suicidal. So I'd call this hotline and I'd say, give me a reason. Give me the exact reason why living is so important.
Stephanie Rodriguez Anderson was devastated following her divorce. Eventually, the sadness she felt for the loss of her marriage enveloped her, and she started to close herself off from everything and everyone around her.
And that's what the problem with depression is, that we have loss of interest. We don't have enough energy to kind of go around and do things that we were doing before. So as this isolation increases, the sleep disturbance, the appetite disturbance, the mood getting worse, the hopelessness could set in.
It just went into my mind, why don't you just slit your wrist and get it over with? I knew then I needed help.
Fortunately, Stephanie realized that not being around would be a far worse fate for her family. She is now getting the care she needs with medication and an intensive therapy regime called Partial Hospitalization Program.
They balanced me out, my mood, they balanced me out, my thoughts. So I take a lot of pills right now, but it balances me out.
A tragedy was diverted because Stephanie finally asked for help, but that almost didn't happen because of the stigma that comes with mental illness.
So I want women out there, and men, because it happens to men also. I want them to know, don't be ashamed. You know, we're all in the same boat. We can all get help, and we can all learn how to deal with, okay, so you may not get totally better, but we can all learn how to deal with what we're going through.
Many of the patients treated in Eden Medical Center's psychiatric unit suffer from some degree of depression, but they also treat patients who suffer from bipolar disorder, a condition that wreaks havoc with its victims' lives.
Bipolar illness was originally known as manic depression, and it's the elevated mood and then the total dumping underneath.
Leticia had struggled with depression all her life, but never thought she could also be suffering from bipolar disorder. From the little she knew of the disease, she just didn't fit the profile.
Some of the characteristics people will have, like shop till you drop, feeling bigger and better than themselves, you know, this I'm God kind of thing. And so they give me a brief description. I was like, no, that's not me. But in hindsight, I knew I always was what they would call moody. I would have highs, and then I knew I would have some lows.
But after a few years of taking antidepressant medication to treat her depression, she found herself behaving in a manner that was completely out of character for her.
I didn't know what was going on. I really didn't, and had no idea I was being faced with a serious illness, and found myself getting into hot water trouble. You know, something was just falling apart and I had no control, but had no idea that it was bipolar.
Leticia's story is not unusual for someone who suffers from bipolar disorder.
Bipolar disorder is a complex set of symptoms. Many times it would first appear as depression, and if not rightfully treated, it would become a manic phase. What happens is that in the manic phase of bipolar disorder, people feel they could be angry or irritated. They could have elevated mood. That means that they have high energy. They have lack of control over their sense of pleasure. They're reckless, and these feelings would alternate with mood states of depression.
Like severe depression, bipolar disorder can be controlled with medication and therapy, like Eden's Partial Hospitalization Program. Patients can learn to manage their condition and, more importantly, regain control of their lives. We just saw two disorders. One was depression and one was bipolar. Going back to the first one, depression, how do you know when you're not just feeling blue, or it's something worse than that and it could actually be depression?
So holiday blues is a phenomenon that is short-lived. It would last less than 2 weeks, and people would feel they have difficulty in concentrating. They would have a depressed mood. They might feel fatigued and tired, but it would not progress beyond those 2 weeks, or people would feel they have hopeless or helpless feelings. or feeling that life is not worth living. If symptoms like that happen, then of course we know that it needs to be treated. So in major depressive disorder, for a period of 2 weeks, people feel depressed. They have no desire or ability to kind of deal with their normal daily activities, what they're able to perform. They have difficulty in concentrating. They have no energy, or they have decreased energy. They might sleep more, they might sleep less. So oftentimes we see in depression that people have frequent awakenings during the nighttime, and they would have early morning awakening. We call it latency. They also would have, in terms of appetite, they would feel that they have, some people feel lack of appetite, they will lose weight, and some people, they eat more, they gain weight during a period of depression.
And those are the physical symptoms. If you recognize that in yourself or someone else, and it's progressing beyond just the 2 weeks, what should you do to help your loved one? What should you do to help either yourself or your loved one if you think, wow, I might really have this depression?
Of course, we know there's a lot of stigma in terms of depression. People don't like sometimes hearing the word depression. They would think that it's a problem with the family. The mother thinks it's their fault. Sometimes there was a problem growing up in the family that would cause depression. So one thing would be to understand what the symptoms are and provide support to our family member, and go seek a consultation with your primary care physician. There are certain medical reasons, medical disorders in thyroid diseases and other diabetes, onset of diabetes, and other medical problems that would present as depression. So normally we rule out those reversible causes, and then with the treatment of depression, it's 95% of the treatment, 95% of the patients who are treated for depression, they improve.
So great odds, 95% can get help and improve. One quick question, because we were talking about bipolar. If you have depression, is that going to lead you into turning into having a bipolar disorder?
So we know from the research that commonly people who have repeated episodes of depression in the past are people who had episode of postpartum depression or psychotic depression, people who have taken antidepressants and they have become hypomanic, or people who had a treatment response and subsequently they've stopped responding to the medication and they have mood swings. These are the patients that often would convert to bipolar disorder.
So it can in a small percentage of cases.
Yes, they would convert into a bipolar disorder, and it's so important to treat the bipolar disorder because the treatment is different.
Okay, so treat the depression and then treat the bipolar if that absolutely comes up. Now, when we come back, we'll tell you about a treatment that has been around for nearly a century and why it's gaining new popularity now.